I think there are really complicated feelings about measurement-based care. On the one hand, people believe and understand that with measurement-based care, people get better faster, they drop out of treatment less, and they improve more. And there's a lot of clinicians who are down for that revolution. And at the same time, there's a lot of challenges from an implementation standpoint that really, I think, damper the enthusiasm. And I think one of the key ones beyond, let's say you get a really great measurement feedback system, you really have an integrated sort of EHR interoperable system, there's really low friction for the patient. It even spins up for you some things that you can put in your documentation. And let's say that piece is taken care of. The Joint Commission puts this other standard of you have to also now use these data in aggregate to understand something about the performance of your overall program. A lot of clinicians then say to me, well, it sounds like maybe the next step of that is we're going to assess individual clinicians' performance. Right. And then that's going to have some bearing on
I'm going to get fired. I'm going to get demoted. Right.
Yeah.
Right.
Or I'm going to begin to inadvertently or maybe sort of conscientiously adjust my caseload because I'm concerned that patients who are at higher levels of acuity where the treatment would have them maintain their symptomatology is going to really disadvantage me because I need to showcase that there's a decrease in these symptoms over the course of the tool. So I think there's complications in terms of how people are actually leveraging the practice that make it hard for folks.